Thanks for joining us. Oh, we're live now. So, oops. Well, it's 12 o'clock in Philadelphia. Thanks for joining us. We took a break on our Facebook Live. Joyce is in a lovely location, undisclosed at the moment. But we were just talking about that. And, we took a little tiny break over the summer, but we're back talking about, healthcare and what patients can do, to help themselves and help their doctors. And today we have a guest, Shelli Pavone from Inlightened. And Shelli, would love to hear a little bit of your backstory. And then we'll get into a couple questions.
Yeah, sounds great. So I have been in the healthcare field for my entire career, so close to 20 years now. Worked for large pharmaceutical and device companies, and really have spent the last 7 or so years of my career focusing on smaller health tech startups. And 2 years ago, I started my own company, which is called Inlightened. And Inlightened is an online marketplace composed of a diverse group of healthcare professionals and experts who are really passionate about healthcare innovation. And we facilitate collaboration via paid consulting between those healthcare experts and industry in order to advance healthcare innovation and also facilitate responsible disruption.
So just something small.
Yeah, it's a small undertaking.
A small undertaking, yes.
Yeah.
Can you, Shelli, can you say a little bit more about what you mean by like responsible disruption? Because I think our audience would love to hear about that.
Yeah, absolutely. So, this is timely because we see some of the Theranos trial in the news, right? And that's a great example of disruption that's not responsible. I think that in the startup space, we talk a lot about disrupting industries, move fast, break things. And in the healthcare industry, there are different considerations that have to be taken. Patients' lives are at stake. And so when we put, responsible in front of the word disruption, we're really looking at the innovators in the healthcare space to take on the onus and the responsibility for doing the background research and due diligence to make sure that we're not just moving fast and breaking things. We want to be able to move fast, but we have to make sure that we are taking the necessary steps to include safety for everyone involved as well.
That's really great.
That's really important. One of the things that we wanted to just discuss a little bit is, in fact, I just did this myself for a family member where I played Dr. Google. And we even joked with our doctor about that I was doing that. Besides doing that research, what are other things that we can use with this plentitude of technology that we have, but specifically, is there health tech that we can use to help ourselves as patients?
Yeah, I think, today there is more information available to us about our own bodies and our own health via technology than there ever has been before. And if you own a smartwatch or a smartphone, in most instances, you can access data about your heart rate, about your mobility metrics, cardio fitness. You can track your sleep patterns with a smartphone or something called an Oura ring. And having access to all of this data is great, but I think we really need to understand how to interpret it responsibly in order to truly take control over our own health. And that is where something called health literacy comes into play. And health literacy really refers to the level of competency an individual has in terms of being able to understand kind of basic concepts as they pertain to issues of health. Healthcare and prevention. And then, of course, there are a number of apps that can kind of help us boost our health literacy. And I think that's really the first step to kind of using technology in your own health. And so the U.S. Center for Disease Control and Prevention have developed an app. It is called Health IQ, and it is a trivia-based platform that helps individuals learn more about important health topics and improving their health literacy. And then, a major cornerstone of proficient health literacy is also being able to make informed decisions with regard to things like exercise, diet, and nutrition. Factors that can influence the likelihood of chronic illness down the road. And so there are also a lot of apps that can help with that. But there's one particular app called the MyFitnessPal app, which delivers a fairly comprehensive guide to nutrition. So when it comes to really taking control over your health in that regard, I would say knowledge is power. Accessing, anything that can give you that additional information. And then, if you're suffering from an acute symptom, there are much better resources that are available to you than just Google. Enlightened has a client, their name is Buoy Health. And Buoy's tagline is, we help people make the best decisions about their health. And they do that in a couple of different ways. So first of all, if you have symptoms that you're concerned about, instead of kind of just winging it via Dr. Google, right, you can actually open a chat on Buoy's website and explain your symptoms to Buoy. And then you get feedback on those symptoms from the causes to severity. They kind of give you some clinical insight into what might be going on. And then ultimately, they help you kind of choose the right care option by guiding you to the right services based on your condition. And then if you give them permission, they'll actually follow up with you. And so I think that that's a really much more targeted way to get background information about your health. And then also, if you don't want to open a chat, you can just go to Buoy's website, and they provide a ton of resources for learning. You can do looking up number of health articles. They can be searched by body part, by symptom, or by general topics A to Z. And so what they're taking is, kind of that large amount of information that's available from a lot of different resources on Google that aren't necessarily vetted, and really bringing it into a more safe space to do that research on your own.
Right. That's really, really important. Did you have a follow-up, Tracy, or?
I'm sorry?
I'm sorry. Did you? I didn't mean to speak over you. Did you have a follow-up? Or?
No, I just I think that's really interesting, because the other thing about Dr. Googling it is you look at the worst case scenario, no matter how optimistic a person you can be. And if you're a worrywart, you're definitely looking at worst case scenario. So.
Yeah, absolutely. And, I think each person is individual, and you're looking at a worst case scenario and options that have come from people. And we don't really have a lot of insight into the actual symptoms that were presented. It's really just kind of a catch-all. And I think that's the problem with using something as, variable and broad as Google, is that, sure, a lot of symptoms can lead to something terrible. It doesn't mean that that's what yours are.
Right, exactly. We do have a question from Carrie, and I'm not sure which website that they're referring to, but was it Buoy?
Yeah, I think probably it's Buoy, maybe.
Buoy.
It's spelled B-U-O-Y.
B-U-O-Y. And then maybe could you say again also the CDC Health IQ?
Yes. Yes. So that app is called Health IQ, and you, I believe you can just look it up via, U.S. Center for Disease Control and Prevention, Health IQ app.
Right. So
okay, we answered the question.
Cool. Yeah, just so that people are clear that it's the Centers for Disease Control Health IQ app, because a lot of apps may come up when you look for the app, but make sure it's the one that says CDC or Centers for Disease Control. You're not downloading something that maybe isn't as good or as verified.
Or different, yes.
Yeah. Absolutely.
Yeah.
So Joyce, I think you had a question.
Yeah, I was wondering, how do we benefit? Like, maybe this is a little more philosophical question, but how do we benefit as healthcare consumers and patients when we do have a diversity of voices, in healthcare innovation? Like, why is that so important?
So, diverse voices in healthcare are, first of all, critical to improving the tools and the therapies that boost outcomes and reduce disparities. if you look at the United States, we're a nation where more than 38 million people live in poverty, and where unfortunately communities of color generally face more barriers to care. And one of the core purposes of healthcare innovation is not only to create more efficient and effective care delivery, but it's also to help democratize care. And I think in order to create the most effective products, it's crucial that those involved in designing these solutions represent the perspectives, the cultures, and needs that really mirror that of the people that they serve. To put it simply, the better a patient is represented and understood, the better they can be treated. And so it is incredibly important that the people who are responsible for healthcare innovation, and not only that, but the people that are involved in any kind of piece of the innovation life cycle need to make it a priority to include diverse perspectives. And that's diverse perspectives of, providers as well as patients.
Mm-hmm. Mm-hmm. Yeah, that's really important. Yeah.
Mm-hmm.
And
yeah.
then,
I was going to say, I have an article that I read recently that's kind of an interesting example of,
Yeah, if you could give us an example, that would be really
great.
Yeah, of course. So research, this article that I read recently, it's shown that fewer patents are actually awarded to women than men when it comes to biomedical innovation. And so the study published in Science found that female inventors are more likely to come up with biomedical ideas and products that focus on the needs of women, whereas, of course, male inventors are more inclined to focus on products for men. And so ultimately, it's concluding that society is missing out on potential medications, devices, and technology that could benefit women's health because women are being awarded so many fewer patents. And I think that, again, when diverse perspectives are not considered, those populations miss out on innovation. And, I think conversely, too, including diverse perspectives promotes that a little bit of the outside of the box thinking. And we know that that really leads to unlocking innovation. And solutions that are developed with diverse perspectives in mind are also able to traditionally serve a wider audience of people, which could also potentially lead to greater financial outcomes for healthcare innovators as well. So there's a ton of upside to including diverse perspectives here.
So in terms of Enlightened, your company, I know you gave us some background, but what are you seeing, the people who are coming in, who are looking to use the experts? Like, could you give us a description of the type of startups and the people who are running those startups look like?
Yeah, I mean, we do get a lot of women that have come to Enlightened because, they've had an experience with their own health or a family member, or, especially with women, a lot of women have gone through fertility struggles, or, they've come postpartum and had a tough experience, and they really want to kind of do something to solve some of those problems. And so they come to Enlighten to access, expertise, because not everyone that innovates in healthcare comes from a background in healthcare. And I think that even if you do, it is still incredibly difficult to know all there is to know about, one area in healthcare, let alone multiple areas in healthcare. I have a couple of specific Enlightened clients that are doing really interesting things in this space of kind of education and access that, I'd love to highlight. So one of them is called Healthcare Data Analytics Institute, or HDAI, and they have this tool that is called Health Picture. And it's a free web-based application that provides patients access to their own healthcare data. And they're helping patients become better informed about their current health and health-related risks, as they give people the option to kind of loop in their doctors and their caregivers for insight and shared decision-making. So I actually had my parents get on the Health Picture app because I live in Boston, my parents live in Ohio, and it's just really good for me to be able to kind of log on and have a quick kind of look at not only the visits that they've had recently, but the medications that they're taking, and ultimately the predictive analytics in the Health Picture tool that kind of estimates some risks. And, it's great for anyone who's looking to take better control of their health to have kind of that information in one place. And the fact that it's, free and open to everyone is just, to me, a really, really excellent feature. And then we also have a partner with Enlightened that's doing really amazing things, I think, to empower patients. Their name is Savvy Co-op, and Savvy is empowering people to use their patient experiences to improve health innovations. And so at Enlightened, we talk a ton about getting the perspectives of diverse providers and healthcare professionals, which is obviously incredibly important to healthcare innovation. The goal is that they're treating diverse patients and that they bring their own diverse experience to the table as well, and that they have the clinical knowledge and background to be helpful. But with Savvy, it's really taking the perspective that including patients in the healthcare innovation process is incredibly important. And it's not just including patients in clinical trials, but including them in the research and insight work as well. And so from the perspective of Savvy, whether you have you're healthy or you have a chronic condition or you care for someone with a chronic condition, basically you can sign up and share your experience as a patient and you get rewards. And the rewards are in the form of cash, gift cards, or discounts and coupons. And the real background and story behind Savvy is that they're two founders who are also patients who, have some kind of chronic illnesses that they deal with. And, they were tired of healthcare innovators designing projects and services without talking to patients first. And their whole goal was to restore power back to patients, to give them a voice and make sure that people were fairly valuing the insights of patients. And they're really doing great things. And I do think that the industry is starting to finally recognize how important diverse provider and patient perspectives are to advancing healthcare innovation. And I think that, Enlightened has clients that, really range from, stealth healthcare startups that are just beginning all the way to the larger pharmaceutical and device companies. And, I think that what they have in common is they are focused on responsible disruption and they actually care about engaging, those diverse perspectives.
Yeah, I love what you're saying. I know Savvy. I've come across them in my own research, and I think what they're doing is amazing. Offering us as patients an opportunity to go out there and have our voices be heard. It's really, it's really important.
Yeah.
Can you? I know you just gave us some examples of some of the companies and so on. Do you mind if we go back for just a second to what you were saying about health literacy? Because I think it's something that's so important that we kind of, as consumers of healthcare and so on, we kind of gloss over it. And I think there's a lot we can do to up our game individually, our health literacy. Maybe you could talk about that a little bit.
Yeah, absolutely. I think that in the past, and I'm also guilty of this, right? You assume that your doctor knows everything, and we just are easily kind of ignorant about our own health. And doctors and clinicians are humans, just like everyone else. Some of them are really great at their jobs. Some of them are not so great at their jobs. But regardless, right? They have a ton of patients that they're tasked with caring for. And you as an individual, I think the onus is on us to take responsibility for our own health. And, health literacy is a huge part of that. We need to do the research to truly understand, what is our body telling us, right? Learning to pay attention to your body and understand how things like diet and nutrition can contribute to either a healthy, lifestyle or unfortunately to chronic disease or illness. And there is more information out there than there ever has been, which I know can make it overwhelming for people. And that's why I think it's really important to seek out these specific resources like Health IQ and, the MyFitnessPal app to educate yourself on health and wellness. We need to take responsibility for our own healthcare. And I think that, the more that you understand your own body as well, and that you pay attention to those things, the better equipped you'll be to have a conversation with your physician about when something is wrong. And I think that some of the people that have suffered with illnesses or symptoms that clinicians are unable to really pinpoint, the more that they're tracking what's going on with them and their own bodies. And, I know that Tracy can speak to this as well. The better equipped they are to have those conversations with their clinicians. And I think the better equipped the clinicians then become to help them, right? They're only privy to the information that you provide them about your day-to-day life. And otherwise, there's only so many tests you can run. And so I think that not only, doing the research to up your health literacy, but also paying attention to your own body and journaling and tracking the things that are happening to you as well.
Yep,
and you've brought up a couple of things that I've been thinking about, Shelli, especially, Journal My Health is based on the idea that we have all this data that we are spewing off on, whether it's through collection on our cell phones or things that we can input into our own phone or platform. But we have all this information, and I've been thinking really about how do we empower people to take a look at that data, no matter how many charts that we can create through, working with the data. What can, how do we help our users have a better understanding of what that data actually means, and then how to pose those questions? I feel like that's sort of the next step as we continue to bring this product to market. And, I think that that's a really important piece of this as well. So where's that bridge between patient and doctor? And some of the correlations that I've been thinking about, or analogies, is how do I wind up speaking to developers, the software developer? I don't code, but I have to be able to talk to them so that they can create a product. So I sort of feel like there's an analogy there. So I've learned some, of how to do that. And there's various tools that we can put together, wireframes to bridge that gap. So I feel like there's that communication, the language gap. And sometimes as patients, we may be, I don't want to use the word afraid, but maybe not as confident to talk to your doctor in that way.
Yeah, absolutely. I think it can be intimidating. And, that's why it is important to have a primary care provider that you feel comfortable with and that you have a good dialogue with. But I think the more that you take the time to, engage yourself around some of these things and learning and health literacy, again, you'll feel better about going to your clinician with that, because you have taken the time to research and understand, and you can speak that language a little bit better. I think that just like you're not going to overnight be able to speak to a software developer in that tech language, you can, figure out some of the jargon and vocabulary to, transcribe your message to them in a little bit of a better way. And that's the same thing that we can do with, upping our health literacy and speaking with clinicians. We can kind of learn the language to some extent so that we can have an intelligent conversation about our health.
Right.
Yes. Right.
We're getting to the, end of our time, and I wanted to see if anyone in the audience had a question. And there's lots of chat here, so I appreciate that. If you don't, no worries. But, I think this conversation of how we can equip ourselves to continue to be better patients and be confident in having these conversations with our doctors and other healthcare providers is definitely something that's extremely important. That's certainly a theme that we've been running with on our Facebook Lives. And Shelli, I think it's great that you are helping maybe what we would term non-traditional healthcare innovators to come in and be able to take their ideas and figure out how to bring them to life. Oh, we have one. Okay. Oh, Joyce, will you post the apps and websites on your page?
Yes, Absolutely. We will post them. We'll post all of them because I think they're just really important for everybody to know about, because it is key at the end of the day that we be able to ask questions of our providers, and then ask our providers, like, okay, what information should I be reading? What is the right information for me? Because, you know, you could have a condition, but you may be in a different place in your condition. And so the content that you're reading may not be exactly right for you. That's why I love what you're saying about the app with the chat buoy that helps you get to a place of more specificity so that you can come up with something that's more aligned with exactly where you are. So that's the key.
And I do think that this points out that we as patients, as consumers, because we are consumers when we get right down to it, even though we may not be in the best place at that time, we need to be more informed, and we need to take the time to be more informed.
Very true.
So
feel empowered.
Yes.
Well, that 30 minutes just went by very quickly. We thank you, Joyce. Thanks for sharing the stage, and Shelli, thank you so much for this view, and would love maybe for you to come back with a couple of the groups that you're working with, some of the companies that you're working with. We could have some more conversations and highlight some other companies that are doing some really interesting work to help patients.
Absolutely. I would love that. And thank you so much for having me. This was great.
Yeah, thanks so much.
Thanks for everyone for joining us. And this will be posted to view again. So hopefully you can share with those in your networks. This is Tracy Wilson-Rossman from Journal My Health signing off.
Take care, everyone.